Swallowing disorders, also called dysphagia, can occur at different stages in the swallowing process. The oral phase is sucking, chewing, and moving food or liquid into the throat. The pharyngeal phase is starting the swallow reflex, squeezing food down the throat, and closing off the airway to prevent food or liquid from entering the airway, or to prevent choking. The esophageal phase is the relaxing and tightening the openings at the top and bottom of the feeding tube in the throat, and squeezing food through the esophagus into the stomach. Some signs and symptoms of swallowing disorders include several diseases, conditions, or surgical interventions that can result in these problems. General signs may include coughing during or right after eating or drinking, wet or gurgly sounding voice during or after eating or drinking, extra effort or time needed to chew or swallow, food or liquid leaking from the mouth or getting stuck in the mouth, recurring pneumonia or chest congestion after eating, or weight loss or dehydration from not being able to eat enough. As a result, adults may have poor nutrition or dehydration, risk of aspiration, which can lead to pneumonia and chronic lung disease, less enjoyment of eating or drinking, or even embarrassment or isolation in social situations involving eating. A speech-language pathologist who specializes in swallowing disorders can evaluate individuals who are experiencing problems eating and drinking. The SLP will take a careful history of medical conditions and symptoms. They look at the strength and movement of the muscles involving swallowing. The SLP observes feeding to see posture, behavior, and oral movements during eating and drinking. They possibly will perform special tests to evaluate swallowing, such as a modified barium swallow, which is when an individual eats or drinks food or liquid with barium in it, and then the swallowing process is viewed on an X-ray. Endoscopic assessment might also be assessed. This is where a lighted scope is inserted through the nose and then the swallow can be viewed on a screen. Treatment depends on the cause, symptoms, and type of swallowing problem. A speech-language pathologist may recommend specific swallowing treatment, such as exercises to improve muscle movement, positions or strategies to help the individual swallow more effectively, or specific food and liquid textures that are easier and safer to swallow. Some causes of feeding and swallowing problems in adults are damage to the nervous system, such as stroke, brain injury, spinal cord injury, or even Parkinson's disease. The SLP's role includes identifying the signs and symptoms of dysphagia, identifying normal and abnormal swallowing anatomy and physiology, providing safe and effective treatment for swallowing disorders, documenting progress, and determining appropriate dismissal criteria, along with many other roles and responsibilities. Modifications to the texture of the food may be implemented to allow for safe and oral intake. This may include changing the viscosity of liquids and/or softening, chopping, or pureeing solid foods. Modifications of the taste or temperature may also be employed to change the sensory input of the bolus. Examples of postural techniques used in dysphagia therapy include the following: chin down posture, chin up posture, head rotation, turning to the side, and head tilt.